Hi class. For my final project, I decided to examine the topic of religion and medicine and how they work together. As someone who grew up in a church while having doctors as parents, these two fields have always been connected to my life. But after taking this class, I found endless connections between both religion and medicine. In class, we learned about the Hippocratic Oath and the origins of medicine that involved the guidance of Greek gods such as Apollo and Asclepius, illustrating religion's essential role in medicine since the beginning of its practice. As Dr. Bishop said in his lecture, health is something that is of great importance due to our lack of understanding as to why we are alive, and there is a mystical and sacred responsibility that a doctor carries in caring for the precious gift of life. Life and death are concepts that are dealt with on a daily basis in both fields, and it is through the actions of doctors that save lives and bring lives into the world, allowing people to appreciate life's precious gifts in our mortality. However, there are many things about religion that complicate medicine's goals. For example, the issue of abortion is a largely debated topic. Many religious leaders criticize taking away the life of an unborn fetus, while doctors champion a woman's right to do what she wants to do with her body. On a note related to our current situation, there is also the persistent debate of social distancing and religious services. Against medical experts' advice, many people have advocated going to church to celebrate holidays important to them, such as Easter. While medicine and religion can clash, they can complement each other's purpose through a mutual understanding of how they benefit our lives. Through this research project, I examined in a more detailed perspective how religion affects medicine through the lens of health professionals, church leaders, and citizens dealing with the coronavirus. I chose to represent my findings through a video of my interview subjects. I decided on interviewing my mom, who's a veterinarian, my dad, who's an OBGYN, and Maggie Jones, a leader at my church. I chose these subjects because I think they deal with both religion and medicine in their daily lives. As these three people have all had a profound impact on my life, I wanted to see how they view things as religious and health professionals, and I think this just further illustrated how religion and medicine are hard to separate. I thought that we were able to see my mom, my dad, and Maggie as real people, not just professionals, and they all deal with their own meaning of the human experience in the workplace. After this project, I came to the conclusion that religion holds too many positive impacts on medicine to be a hindrance. When doctors treat patients, they have to consider a whole set of circumstances which decide the approach of healing a patient. With an understanding of religion and the fragility of life amongst their patients, doctors can reclaim their human qualities of empathy and vulnerability, allowing them to gain a sense of why and how they can do their best job possible. Finally, as religious communities rally and send loving messages to the doctors, nurses, and other first responders that deal with death and chaos every day, the reminder of solidarity as a human race can be a great comfort through prayer and support. Special thanks to Dr. Taylor, Dr. Chow, and Maggie Jones for taking time to answer my questions. Without further ado, here are my interviews. Please enjoy. Tell me about your professional career.
First, I was a nurse and practiced in pediatrics for almost a year, and then about 6 years in postpartum and labor and delivery nursing. And then now I went back to school in '97, graduated in 2003, and been a vet for 17 years now, small animal vet. So I'm involved with the health of mostly cats and dogs. There are many reasons I chose nursing before ultimately going back to vet school. Originally, I felt that helping people was more important because of my religion, that it was more important than helping animals. But in helping animals, I realized that I can help people because their animals or their pets are very important to them. And for some people, their pets are the only relationship they have, the only meaningful relationship they have. So by helping keep their pets healthy, then I'm helping them in that way.
So, how does your own religion affect your practice as a doctor and as a veterinarian?
I think that it's helpful um, because my outlook on death is better than it would be if I wasn't religious or I wasn't Christian. Christians believe in life after death, so I have a better outlook on death, so it helps when I have to perform euthanasia or when there are pets that I just can't help, that I'm trying to make better and then they die. Um, it makes it more bearable. Um, on the flip side, there are certain instances where the religion would make it harder for me to practice, as far as if I worked in a humane society, they do C-sections on dogs and cats that are pregnant, and so they will do it at any stage. So even if they're just a week away from being born, but yet if they were taken out, they wouldn't live. They do it anyway, and I would have a hard time with that, probably because of my religion or just respect for life. So.
So how do your patients, as in like the pet owners, their religion, affect your profession as a veterinarian? And I guess when you were a nurse, how did the patients that you saw, how did their religion affect what you did as a nurse?
As a veterinarian, people's religion doesn't affect my practice that much. Occasionally, it does, like in the instance of a patient or a client once that wanted to have a priest bless her cat before we were going to euthanize. So only in the fact that it makes me maybe make some exceptions where I wouldn't, or do things to respect their religion. And then as a nurse, also it's just the way affects my practice in the way I have to treat them and respect their religion, as far as, for example, I took care of a woman who was Orthodox Jew, and they're not allowed to work on the Sabbath, and so you have to do some things for them that they normally can do for themselves because of their religion.
So, how do you deal with the death of animals, and is religion involved in your response?
Yes, because of my religion, my outlook on death is influenced by my religion. So that helps me cope with death and having to put them to sleep, and realizing that I can't always save their lives, and that death is natural and part of life, and that I have a belief in life after death. So even for pets, so that helps.
So going back to when you were a nurse, were there any times when religion, either yours or the patient's, like negatively affected your job experience?
It hasn't ever negatively affected my practice or experience, but I do know labor and delivery nurses who would not participate in the care of women who were terminating the pregnancy because they were Catholic, and abortion is not allowed in the Catholic religion. They wouldn't take care of those people that chose to do it.
Okay. And so when you look at the current events of the coronavirus, how do you think that this pandemic deals with both aspects of religion and medicine, in terms of the human experience and also the response? Just wanted to know your thoughts as a health professional and as a religious person.
I think religion can have a negative influence on the way some people deal with this virus. They think that because they are religious or going to church, they're not going to be affected by it, and then they put themselves at risk. but it has more positive effects for people that so they don't get so depressed and overwhelmed and hopeless about the whole situation of the coronavirus. If you have a positive outlook and you have faith, then you're more likely to deal with illness better physically if you have better mental health. And so I think it helps people having better mental health, and then that way dealing with illness.
So overall, do you think religion has more positive effects or negative effects on your practice as a veterinarian?
Definitely more positive effects. Knowing that there's a higher power at work prevents me from getting too discouraged or overwhelmed. Like I said earlier, I'm helping people, and I feel like that's what the Christian religion asks you to do, is to help other people, love your neighbor, and I'm doing that by helping their animals. And also when bad things happen, like death, or their animals are sick, sometimes it's just part of the plan, and it doesn't get overwhelming or too discouraging. So
Thank you. Tell me about your professional career.
I'm an obstetrician gynecologist, and I am in a private practice in Edina, Minnesota, and we deliver babies and do surgeries at 2 hospitals close to the office.
And how long have you been doing that?
I've been practicing since 1996. I finished medical school in 1992 at Northwestern University, and did 4 years of OBGYN residency training also at Northwestern through 1996.
How does your religion affect your practice as a doctor?
I would say more than religion per se. It comes into play in different situations with patients that require some thought and reflection. Also, it's kind of a two-way street. I always encourage people to be open-minded, and I think it helps me in times of thought to maintain my own level of open-mindedness as well.
How do your patients' religion affect your profession?
I think there's only a small percentage of the time that it comes to the forefront, but in those times you have to be respectful of different people's beliefs and the choices they make with their healthcare.
So, how do you respond if your patients ask you to do something against your religious beliefs, or vice versa? How do you react if someone made a decision based on their religion against your advice?
The most important thing for me is to be able to give people options with regards to their health care. You certainly don't want to be judgmental about their decisions. And one thing that I've said to patients numerous times is that they wouldn't, it's important for me to understand my limitations as well. So I can give people options with regards to their health care, but if it happens to be a rare occasion where there's something that I don't agree to do or agree with, that I understand my limitations and try to help them explore different options. In terms of if someone made a decision about their health care that was against my advice, what's important is to document thoroughly the nature of our discussion and just adapt to that situation.
How do you think the religious aspect and pro-life argument of abortion affects your profession as an obstetrician gynecologist, and do you think it hinders your work?
Um, every now and again, I'll receive some pro-life propaganda in the mail in my office, and that's always interesting. Um, it does come up. Occasionally, we'll have patients who want abortions. Uh, occasionally we'll have pregnancies where a woman is carrying a fetus that is abnormal, sometimes not compatible with life, and the issue of abortion does come up. Um, Again, you support people in their decisions, you help them make their choices, but the overall pro-life sentiment in that part of society doesn't really hinder what I do. Thankfully, again, it's obviously a very individual choice that patients have to make, and my job is to give them options and guide them through those decisions.
So, how do you think the coronavirus deals with both the aspects of religion and medicine in terms of the human experience in response to the pandemic? And what do you think has been negative? What do you think has been positive in these trying times?
It's something that is certainly changing every day. There's a pretty significant part of the population that obviously thinks that faith can override any element of science. In the news every day there is this pretty distinct discussion of the dichotomy between those two issues, faith and scientific fact. There have been some sad stories, and interesting choices that people make. I certainly think that there's a large portion of the population that will stick with scientific recommendations, but certainly will look to their faith to help them get through these trying times. But again, it's all individual. People have different thoughts, and we're certainly learning about how that is all evolving during the pandemic.
So, overall, do you think that religion has more positive effects or negative effects on medicine, on your practice, how you deal with your patients?
Certainly more positive. Again, it's not something that openly comes up in discussion, but you naturally assume that the choices that people make with their in their relationships and in their healthcare stem from very personal thoughts, which include religion. So I don't view it as a negative at all.
Thank you.
Hi, my name is Maggie Jones, and I'm the Director of Youth and Family Ministry at Normandale Lutheran Church in Edina. I know Jacob from being his youth director while he was in high school. I absolutely think that religion and medicine can go hand in hand. I'm a firm believer that science informs faith and faith informs science. I think that medicine does play a role in religion. I think that to be people of God, we also need to be people of curiosity and intelligence and openness and conversation. And part of that is following protocols and following what. In order to have successful faith communities, we need to keep our community safe and healthy. And a big part of that is listening to what the professionals and the doctors are saying. And so part of that is getting the medicine that we need and following what the recommendations are of our most intelligent leaders right now. No, I do not think that the role of medicine in our society can hinder my goals as a youth director in a church setting. I think that it only helps when we are informed and when we're having conversations. I think that faith and medicine go hand in hand. I remember reading once that faith and science inform each other, and both are stronger when they can go hand in hand. I think that goes for people in our society as well. I think that religion has not been negatively impacted by standards of science and facts. I think some people like to poke holes in both sides, but I think that both are stronger when they work together. I think that both science and religion can bring comfort and knowledge. I think that science influences the way that we live our lives all the time, and I think it's really, really important to draw on scientific conclusions. But I also think that religion can help provide comfort and answers when there aren't any answers. In terms of the pandemic, I think that it is so important to listen to the professionals and to listen to doctors and nurses on the front lines, to listen to experts about what we are being asked to do in terms of slowing down the pandemic and keeping our community safe. Faith teaches us to love our neighbors, and I think the best way to love our neighbors is to stay home and to rely on faith to provide comfort in these times. But no, I do not think that it was right or that it is right to try to practice our faith in community spaces like churches and congregations. I believe that God is with us wherever we are. I believe that God is with me right now. I believe that God is with us when we have virtual gatherings. And I think that that is what we're being called to do as Christians right now, is to care for one another by distancing. I think that people who choose to practice their religion, choose to have faith, I encourage them to also look to science and to try to work together in those things. I think that religion does have more positive effects on medicine. I think that prayer and community, the things that my faith has brought me, I think that those things are things that I would rely on when science and medicine are at work. I think that I would also use my faith as a support to aid that as well.